You are currently the only person in this conference.
During the AIDS stage. So this care is extended from the health facility to the patient's home. I think I've already said that. Then I want us to go through the and see who gives the care to this patient. The care is not only through the caregiver, but you still, or this person still needs some support from the community, from the family members, wherever they are, where they're living, or if they're not living with them, wherever they are, they need support from them. They need support from relatives. They need support from the entire community, because when the community is not supporting these people, when the community is not supporting, for example, people living with HIV and AIDS, where they're stigmatized, where they're denied their rights, where they are just discriminated just because they have HIV and AIDS, that will deteriorate their status because they will live in denial. So we need community members, we need healthcare workers who will advise, or who will train the caregivers, who will train the relatives, who will train the family members on how to take good care of this person. So caregiving is done, or is provided by all of these people. Then let's see the components of home-based care. So since home-based care goes side by side with prevention, so HIV and AIDS home-based care, it normally focuses more on prevention. You're preventing this person from getting other opportunistic infection by treating this person, or by taking good care of this person. You're also, during home-based care, you also taught on how to prevent yourself from getting the infection from this individual that you're taking care of. You also encourage on many psychological issues, because when you're taking care of a sick person, you still need some psychological support. So, and this home-based care is a comprehensive care, where it involves, majority of people have already said that, where you're involving the individual, you're involving the caregiver, you're involving relatives, you're involving family members, you're involving the entire community, and also you're involving many other aspects. You're not only washing this person, you're giving them medicine, you're preparing good meals, you're giving them psychological support, you're giving them emotional support. So it's a comprehensive care that involve or integrate a lot of activities and a lot of people. And another thing still under home-based care is that it is aimed at decreasing the social impact of HIV and AIDS to this person. It's normally, when you educate people on HIV and AIDS at the community level, they'll be able to overcome stigmatization. And when they overcome stigma, or they don't practice stigmatization on AIDS or on HIV and AIDS, you're helping even both the person who is suffering from the HIV and AIDS, and also you're helping the family members. So this, it normally decreases the social impact of AIDS, because AIDS is stigmatization is highly prevalent in our community members. So it normally hence enhances preventive measures, spread of secondary infection or the opportunistic infection, and also help strengthen the existing healthcare systems. So home-based care is aimed at all doing that by decreasing stigmatization, by decreasing new infection, by enhancing preventive measures, by preventing opportunistic infection from occurring, and also strengthening the healthcare system. So in order for home-based care to work, there is need to provide essential drugs and supplies required for HIV care, including protective clothing and disinfectants. So still home-based care, you need drugs, and not only ARVs, you need also other antibiotics, you need some nutrient supplements, you need gloves, you need disinfectants such as Dettol and the like. So all these are needed in home-based care. Now that we have understood more on what is home-based care, home-based care aims at prevention. It aims on decreasing infection, decreasing new infection, decreasing increase of opportunistic infection in the community, and also it will also involve the use of other drugs and other supplies that are normally used in home-based care. Then the main aim of this home-based care is prevention of new infection. That's the major aim of this home-based care. So that was just an introduction of what will be involved in the comprehensive care or in the component of home-based care. I don't want you to get confused here. This is an introduction. These are not the components of home-based care. The components of home-based care, which is a comprehensive care, is clinical care, nursing care, counseling and psycho-spiritual care, as well as social support. So we'll go one component after the other. So the first component is clinical care, where it is clinical management or involve clinical management of HIV and AIDS, which includes early diagnosis of especially opportunistic infection, treatment of this opportunistic infection, and follow-up on the progress of the treatment of this opportunistic infection and conditions associated to HIV and AIDS infection. So right now you're dealing with a person with HIV and AIDS. So in home-based care, you need to also offer clinical care. So in home-based care, you still have some nurses or some clinical doctor coming to home now and then in order to look or identify by diagnosing this person if in case they have opportunistic infection. You still have nurses or clinical doctors or even medical doctors coming home to treat this person if in case they have any opportunistic infection. And then they need also to follow up whether the treatment they used to treat this person is working or not in the treatment of opportunistic infection and other HIV infection. So clinical care is majorly provided by medical doctors and healthcare workers. So clinical care is majorly provided by healthcare workers. So what do you require in clinical care or in clinical care in home-based care? So you require a trained clinical personnel, and clinical personnel can be a doctor, can be a nurse, can be a clinical officer, can be a paramedic staff, can be in the pain management, can be a psychotherapist, can be a laboratory technologist, can be a nutritionist, can be a social worker. So these clinical trained personnel, you need them in clinical care. So you're not the caregiver is not the only one who is taking care of this person. You need other personnel for you to be able to achieve clinical care. Then you need also to have drugs for the opportunistic infections. You need antifungal, you need antibiotics, you need diarrhea medicine. If in case this person is suffering from bacterial infection, you use antibiotics. If this person is suffering from TB, you use anti-TB drugs, etc. If this person is diarrheaing and vomiting a lot, you need to use Resomos, rehydration solutions that are normally used in order to regain the lost water. So we also have herbs and effective local remedies, but we normally discourage people from mixing herbs with ARVs due to drug-drug interaction. So when they interact, the herbs will decrease the effectivity of the ARVs. Then we have ARVs now, and these have known benefits and should be made available. So what are the conditions that need to be necessary for clinical care to occur at a home? So you need documentation, number one, of home-based care activities by each implementer at all levels to avoid duplication. So you need documentation of all the activities. For example, this doctor came and treated malaria, but maybe this malaria didn't, you found that maybe this person is deteriorating, and you want further, maybe another doctor to come and see this person. So the documentation of the first doctor will guide the second one to avoid duplication of whatever that was done by the first doctor. If, for example, if it is taking of the ARVs, if you don't have good documentation, you might end up taking the ARVs twice. So you need documentation in order for you to be able to overcome duplication of the activities being done. For example, if a nurse came and dressed a wound of this person and didn't document, another person might come and repeat the same thing if it was not documented. So another thing is teamwork and networking among all care providers at both health facility and the community level. So you need a teamwork where people are working as a team, or people are working in a coordinated manner. So this coordination will bring out good results, or will act to the benefit of this person. So you need where the nurses are working hand in hand with the doctors, and not vice versa, where the nurse comes, does whatever they want, the doctor comes and do whatever they want to this patient. So there must be a coordination in whatever they do. There must be a networking or a more coordinated way in what in how they're doing their activities. Then we have proper supply of drugs and nursing supplies to health facility and community health workers who may be doing outreach or home visit within a given community. So they need to be supplies of drugs, of gloves, or whatever they need to use in the clinical care. Because when we don't have proper or sustained proper supply, people will not be able to practice this clinical care to this patient. So there need to be a proper supply of drugs and other supplies that need to be used during the clinical care for clinical care to be effective. Then there must be an understanding of the referral system by the care providers and the family as well as the relative. You need to know when this person is under stress, when this person is depressed, when this person is under hysteria, where am I supposed to take this person? Am I supposed to take this person to a psychologist? Am I supposed to take this person to a nurse? Am I supposed to take this person to a clinical doctor? So there must be some explanation to the caregiver, to the family members, to the relative on what to do if this person experiences whatever condition that they may experience. Then another thing is that formation of support group for caregivers. You still need some support. Even if you're not sick and you're taking care of a sick person, you need some psychological help or some emotional support, because you will be fatigued in one way or another. So you need some emotional support that will help you do your work effectively to the benefit of the patient. Then another one is that supervision of community health workers in the use of simple drugs and supplies within their home care kits. So you need also to supervise. There need also to be a supervision on healthcare workers on how they are using the supplies, on how they are using the drugs, because some community health workers will end up selling these drugs or selling these supplies. So there must be some accountability on how the supplies are being used. So these are conditions under which clinical care can take place effectively. You need documentation, you need teamwork, coordinated activities, you need proper use of drugs and proper supply of drugs, you need understanding of referral system, you need support system for the caregivers, as well as you need supervision of the healthcare workers on how they're using drugs or they're supplying the drugs given to them. That is clinical care. Then the second component of HBC is nursing care. So what is the difference between a clinical care and nursing care? Clinical care deals with diagnosing a disease, treating the disease, and follow up on the progress of the disease. For the nursing care, it normally used to assist people to do things that they're unable to do. For example, if I'm unable to take myself to the toilet, I need your nursing care to help assist me to go and release myself. If I'm not able to wash myself, if I'm not able to dress my wound, or even to dress myself, that is nursing care. You're assisting an individual who is sick or even well to do those things that they would do if they had the strength, the knowledge, or the will, or to a peaceful death. So you need that assistant if you're not able to assist yourself. So nursing care for people living with HIV is aimed at alleviating physical and psychological pain. It normally helps also in releasing or in reducing the amount of pain a person is suffering, either psychologically or emotional or physically, sorry. So this is normally aimed at maximizing the level of function of the affected person. So a systematic assessment of the needs of the sick individual and provision of care to meet those needs is important in achieving the nursing aim. While the people living with HIV and AIDS is in the hospital, recruitment into the home-based care is needed. You don't just discharge a person anyhow. You need to educate the caregiver. If it's, for example, is a nanny who is living with this person, if it is family members who are living with this person, so you need to educate them. How do you dress a wound? How do you wash this wound? How do you deal with this person psychologically? How do you deal with depression when this person is depressed? How do you deal with this person? When this person have some seizure, how do you prevent the seizure from causing harm to this person? If the person faints, how are you supposed to handle this unconsciousness? So nursing care need to be educated or need to be trained to the people who will take care of this person before discharge. So there need to be all that in order for the nursing care to work. So the common presenting problems requiring nursing care: diarrhea, difficulty in swallowing, difficulty in breathing, swelling of body parts, high temperatures, nausea and vomiting, nutritional deficiencies, skin mucus membrane lesions, where the skin have issues, you have some wounds on the skin, unkempt mouth and body, neurological impairment, where you have lost your nerve functions, for example, because in hospitals you are used to sleeping, and by the time you're going home, you find your legs are not functioning well. The nerves are making you're numb on your leg because the nerves have lost their function. So you need to know how to deal with this, or how to deal with this opportunistic infection or symptoms and signs at home. You need some training, or the caregiver needs some training before discharge on how to deal with them. Nursing also incorporates palliative and terminal care. Palliative care is normally given to people who is about to die or who is suffering from diseases that do not heal. We have palliative care for cancer patients. We have palliative care for diabetic patients. We have palliative care for those who are about to die. There's sometimes you hear people say that I'm given 1 year to live. So that 1 year, you need palliative care in order for you to be prepared to die a peaceful death. So nursing care intends to meet the following needs to the extent possible. It aims to control the symptoms. It needs to bring some comfort to this patient. It needs also to work on the nutrition level of this patient. It needs also to work on the coping of loss and change, because once you're sick, you're at your end, you are at the end stage. You have lost a lot. You have lost your money, you have lost your job, you have lost a lot, you have lost even maybe your family members. So there is still a need to an aim of nursing care. One of the aim of nursing care is to help you to cope with the loss. It is also help you to prepare for dying. It also help you to improve on your personal and environmental hygiene, medical and follow-up, or medication and follow-up, how to take drugs, and how do you go to clinics in order to be checked up. Then it also aims at pain management. So these are the aims or the goals or objectives of nursing care. What do you require for nursing care to be effective? Remember, we also said the condition necessary for the clinical care. So what are the conditions necessary for nursing care to occur? There must be nurses and healthcare workers who are trained in home-based care. There must be community health workers and family members trained to provide care. There must be home care kits with gloves, with equipment, with cotton wool, with disinfectant, with basic medicines, skin antibiotics, with vitamin A supplements, all these. There also need to be equipment and supplied for general nursing procedures. Then there must be time and transport. So you need transport and also time for nurses to move from the hospital to the home. You need these home care kits, which will have the nursing supplies such as cotton wool, disinfectants, syringes, etc. So those are the conditions necessary for nursing care to occur. So nursing care needs some linkages, or it needs some support from other cares for it to be effective. So there must be a planned discharge from the health facility and a clear follow-up and supervision system in place for the nursing care also to work effectively. You need to have a planned discharge in that you need to first prepare this person to go home, and also to ensure that whoever is taking care of this person, as well as the individual himself, know how to take care of themselves. Also, the caregiver know how to take care of this person before you discharge this person. Because if you don't have a planned discharge, you might end up having the patient back to the hospital within a very few, maybe weeks or even days, because they need also good care. Then another one is that coordination of communication between the healthcare facilities and the home. You still need a good communication link between the hospital and the home, because at the hospital, you need to follow up on the progress of this person. And also, the person or the caregiver need also to communicate to the hospital if in case there is any eventuality in future. If, for example, this person faints, or if this person gets to us, what do this person do? So there need to be some communication between the hospital and the person taking care, or the family members taking care of this person. Then there need to be a referral system that is agreed upon, in that these support services or these people taking care of this person need to know if in case this person develops a certain condition that is not normal, they need to take this person to the relevant area or the relevant health facility. Then there must be a liaison with other healthcare teams and the village healthcare committees. There must be teamwork still here. Then another one is that formation of network that brings together all the parties. It's explaining the previous point. There must be some network. There must be some coordinated or teamwork that is ensuring that each and every person in the community work to the benefit also of this person. Each and every person supports this patient. For example, if you're dealing with 4 family members in a home, and you don't have food, you don't have anything to eat, it is the responsibility of the community members to help you. So there must be a coordinated activity or a coordinated way of interaction between the community members, between healthcare workers, between the community health workers, between the family members, between the relatives and the caregiver, as well as the individual suffering from this group. It is also important that there be some support system on which on which that maybe the individuals might meet, or people living with HIV and with those conditions meet as a certain area, maybe Wednesdays or in a day, in a week, to discuss on whatever they are passing through or whatever they are getting through. That will help them psychologically to also increase on the information on how to take care of themselves. So that's the second type of or component of HBC. Then the third component is counseling or psychospiritual care, which is normally assist people to deal with their problems that normally affects them psychologically. So it is aimed at reducing anxiety. It is aimed at providing emotional support. It is involved, or it includes promoting positive living among people. It also helps with making informed decisions about HIV testing and life and living. So people with HIV and AIDS, majority of them are under a lot of pressure. They are under a lot of stress. They are under a lot of denial, which exposes them to depression, which exposes them to stress. And due to all this, they need a lot of emotional support. And once a person accepts that they have this disease and they can live with this disease forever, or they can live with this disease a healthy lifestyle or a healthy life or a peaceful life, anxiety will be reduced. They will live a positive life in that they will be able to prevent themselves from reinfection or even infecting others. They will also be able to make informed choices on their life matters, as well as how they're supposed to live a healthy life. So emotional support is really needed in order for people to be adhere to clinical care, to adhere to nursing care, to adhere to all the care that is needed in order for them to survive. So they need this psychological care. So good counseling also involved, you need to have accurate information before you give counseling to this person. You need to be an active listener for this person to be able to accept you. You need also to be self-aware, as well as you need to understand how do you do this counseling. So counseling is needed, but still the person giving counseling need to understand on how the counseling is done, the procedure, how do I, or the skills that is needed during counseling. So all this is needed for psychological care to occur. What are types of counseling that are normally involved in HBC? We have the VCT counseling, where it normally involve post and pre-counseling before you're tested, and after you're tested, you're given a type of counseling. Then you have behavioral change counseling, where people are encouraged to change their behavior. Then we have group counseling, when you're dealing with a group of HIV and AIDS infected people. You're dealing with the family counseling also, where you're educating or you're counseling the families. For example, if the father and the mother are HIV positive and are at the AIDS stage, you still need to talk or to counsel the children belonging to this community or belonging to these two parents, because they need some emotional support. Then we have supportive counseling, we have crisis counseling, we have spiritual pastoral counseling, and lastly we have death counseling or bereavement counseling, where you're counseling people who already maybe left by family members or even friends or even spouses from HIV and AIDS course. So all this type of counseling is normally provided during HBC. So the objective of counseling is to control the spread of the HIV through information dissemination, promotion of safer sex, advocacy for behavior change, and encouragement of better seeking, a health-seeking behavior. So that's the aim of this counseling. Then it normally also helps people living with HIV and AIDS to come into terms with the infection and to adopt a positive living attitude. The first thing is to make this person accept that they have the HIV. And once the person is able to accept that they have the HIV, and HIV is not that, it's not a terminal, is a terminal disease because you'll not heal from it, but it is not like an accident that you'll die the following day. So once you help them accept that, they'll be able to control the spread of HIV, because once a person is in denial, he will want to infect as many people as possible to make sure that, or to even believe that they have the HIV and AIDS. So you need to control, or you need to help them accept that they have the HIV, and once they accept, they'll be able to control the spread of HIV. They will also, by having a safer sex, because if a person is not believing that they have the HIV, they will not bother themselves to have safer sex with their partners. You'll also advocate for behavior change. If they accept, they'll be able to change their behavior. If they were abusing alcohol, if they were abusing drugs, if they're abusing all the types of manners that may deteriorate their health, they will change, because now they are cautious that the immune status is infected or is compromised. And by that, you're encouraging them to live a better, healthy life. So these are the counseling components that are normally involved in counseling care, psychological care, sorry. So I think we already said that when I was saying of examples of counseling, but we can still go through it. Normally, number one is to help the patient to make well-informed decisions about sex and sexuality, offer psychological and spiritual support to people living with HIV and AIDS, help people living with HIV and AIDS to assess and talk about what their life has meant to them through their belief system, whatever they may be. It also helps people living with HIV to accept the need to talk to family members about their condition and future plan. So still, this is some of the components of counseling. What do you require, or what are the conditions necessary for psychological care to occur? There must be confidentiality between the counselor and the counselee. Between you and, or between the counselor and the client who is having this HIV and AIDS, there must be some information that will be very sensitive, so you need to keep them confidential. Then you need to accept this person in terms of their culture, in terms of their belief, their religion. So when you're counseling, you will find very funny beliefs, very funny cultural practices being practiced by your clients, but you're not supposed to judge them. You're supposed to accept them the way they are, and then maybe try to encourage them to change some that maybe affect their health, now that their health is compromised by the HIV and AIDS. Then there must be some training. You as the counselor, you still also need to be trained much for you to regain or to retain your competency in terms of counseling. You also need to train the caregivers on how to deal with psychological issues. You need also to train the patient on how to deal with psychological issues. Healthcare workers also need to be trained on how to deal with psychological problems. How do you deal with, as a nurse, how do you deal with depression? How do you deal with stress if a person comes with such issues to you? Then another one is that you need to monitor or follow up. After counseling services, you need to follow up this patient. Did whatever you told them help them, or did they improve? Did the depression reduce after you've cancelled this person? So monitoring is needed in order for, if in case you need some changes, there need some changes to be done, then you can change in order to help this person. Then there must be multi-sectoral approach when dealing with psychological issues. For example, if you're under stress, you need whoever that is living with you to understand that you are under stress or you're depressed, for them to be very cautious when dealing with you. You need also the community at large to know that you're not okay and give you some emotional support. But if they do not offer you any emotional support and you're dealing with a lot of issues in your mind, you are under stress, you're depressed, you have a lot of mental problems in you or mental issues in you, and the community is not supportive, your family members are not supportive, your relatives are not supportive, even if you go to the counselor 10 times, it might not work because it is a multi-sector. It needs a multi-sector approach for counseling to work. Then there must be establishment of hotline services or referral services. If, for example, this person is depressed, they're not eating, they're not talking, they're already becoming mad, where am I supposed to take this person to? Is it the hospital? Is it to a psychologist? Or who am I supposed to so I hope you're still there. So you need all these are required for psychological care to effectively work. So there must be some practical will and support from all these sectors in order for these sectors to work well. So in order for psychological care to work well in a home-based care, you need all that. They also need some linkages for these psychological support to work. There must be some liaison with an involvement of all other sectors, as already said, an inventory of all stakeholders and counselor at all levels, a hotline for counseling information, a system of networking at all levels, the impact of environmental factors and early involvement of relatives and other people that need to support this person. So all those are the three are the components of home-based care for this person. So the fourth one is social support. And social support can be termed in many ways. Social support can be termed in many different ways. Social support can be termed as in economical way. For example, you're providing employment for this person. You're helping this person to be able to go back to their normal way of economically producing or economically contributing economically to the society. If, for example, you're given this person employment, you're also maybe given this person some loans in order to start a business, you're also giving them some social support. If, for example, you're helping them to relate well with their family members. For example, there was some marriage breakup because a person realized that you're the one who brought the HIV to the family, and the family maybe broke up. So by helping this marriage to come again, or reviving this marriage, or reviving the relationship, they'll be able to relate well with their relatives, they'll be able to relate well with their family members, their spouses. You're also helping them socially to relate well as they were relating before the disease came in. Another way to help these people is to help them understand the effects or the negative effects of some cultural beliefs, or some practices that are being practiced in the community. By helping them see the negative side of it, some barbaric practices that normally increases the spread of HIV and AIDS, increases or deteriorates the condition of a person living with HIV and AIDS. So, for example, early marriages, female genital mutilation, the use of one knives when they're doing their traditional circumcision to boys. So all this, by showing them the negative effects of these traditional beliefs, traditional practices, you will be helping them socially in order for them to live a healthy life. For example, if you're dealing with a person who is a woman and is having HIV and AIDS, and due to the tradition or due to the cultural practices in their community, they're not supposed to take some certain types of food that they really need due to the condition they're suffering from. So by encouraging them, by showing them the negative effects of these food taboos, you're helping them socially, because they'll be able to overcome the effects of those practices or the effects of those traditional beliefs on the person living with HIV and AIDS. When you're dealing with gender issues, because majority of women they are normally misused, they are raped in our community, they are done anything that maybe the males are normally the one who are supposed to declare who they want to marry or something. The girl do not have any say. Those are gender issues that are in some of our traditional practices in our culture, especially the African tradition. You'll also find in nowadays, the males are the one, not nowadays, in our cultures, males are not condemned when they have multiple partners, but for the female, they are condemned. So male will end up having or even spreading this HIV and AIDS to other people. So dealing with such issues that are socially impact the welfare of the community members will help this person or these people living with HIV socially. And that's why we are saying it's social support. You can also give them legal services. For example, if the father ran away because the mother is HIV and AIDS positive, you need also to, the family need legal services because they need to compel this husband who ran away to help this mother together with the children, even if they are HIV positive. If person went through rape, that's why they got this HIV and AIDS, they still need legal support in order for them to seek for justice. So all these legal support, economic and welfare are under support groups. So support groups include helping them improve their welfare economically through legal services, through overcoming barbaric traditional beliefs and practices that will interfere with the treatment and management of HIV and AIDS. So all this is providing social support, are ways through which we can provide social support to HIV and AIDS people. So issues that need social support include burden of care on women. I think I've already said this. So if the father ran away, the family needs social support because they need legal justice or the women or the woman needs some support in order for that woman to be able to take care of these children that were left behind by the father. Then confidentiality, acceptance, solidarity, and stigmatization. When you want to reduce stigmatization in the community and you educate the people or the people in the community on how to accept people living with HIV, you're reducing stigma, and by that you're helping them socially. Then protection of lost jobs and insurance, that's another one, which is economical. Then the role of traditional healing, societal concept of the epidemic, helping these people understand what is HIV and AIDS. And once they understand, definitely they'll be able to accept the people living with HIV to live among them peacefully. Then income generating activities and resource implications. They need social support. In, for example, they lost their business, they lost their job, they need some loans to start new businesses, they need some employment to be able to earn a living. The impact of extent and quality of support on people living with HIV, quality and quantity of life. How do they live a quality life? What are some of the practices that they need to adopt in order to live a quality life? Then the impact of environmental factors on individual and community health, for example, mosquito and rodent control. So they need to be supplied with mosquito nets. They need to be supplied with ways in which they can be able to protect themselves from getting other diseases. Then early involvement of relatives and other social support, social workers and children department also need to be incorporated in social support because, for example, if you didn't involve relatives, they will not be able to know what this person is suffering from. Once they know and they accept, they'll be able to live with them well. Then you have support groups. Support groups are groups that are formed by individuals suffering from the same or similar issues or problems. So by having a support group, you'll be able to encourage each other on how to live a healthy life. Then social workers comes in order to help these people if in case they have psychological problems, they have issues in the families. The social worker comes in order to help them out. Children department, if for example the father and the mother are at the age stage, they're not able to take care of their children, and maybe the children are very young, you need to involve children's department in order to maybe look for foster families or even adoptions for these children. So all these are issues that are normally handled by social support. Sorry. So those are the four components of home-based care. We have clinical, we have nursing, we have social support. And lastly, we have clinical, we have nursing, we have social support. What was the other one? Why have I forgot about it? And we have psychological support. Those are the four main areas under which care is normally given in home-based care. I think we can stop there. Today we had some issues in logging in and yeah, so we can stop there and maybe we can start afresh from next week. We are still on this topic. We are not done with this topic. So I'll post these notes for you to read so that next week we'll be able to move faster once you go through the notes. So next week we'll start with the key players or providers of home-based care, where we have the patient, we have the family members, we have the home care team, we have the health workers, we have the community and the government. So do you have any question, Merab?
No.
Up to that point? Okay, so then we can call it a day and let's meet next tomorrow for HIV and AIDS. Sawa sawa?
Thanks.
Okay.
You are currently the only